Good evening, everybody. Welcome to the Optimal Longevity Series. My name is Jeff Ashby. I represent Engage Global here tonight, the capacity of one of the ambassadors. My wife and I are here leading the charge, and we have some of our best friends that we're going to share with you tonight. Many of you know Dr. Court and his partner. Let's see, what's her name? Sorry, Jonette Biebensheimer. Such great people. I just they've just been in and out of our lives over the last 8 years. Amazing. 1 week ago tonight, they were dodging sprinklers for all of you, and being able to speak with the world's foremost expert on micronutrition and supplementation, Dr. Prasad. But before I turn it over to Dr. Court and Jonette, I need to take care of our disclaimer. And so if you'll follow along with me, we'll protect ourselves legally as I read these words that are on your screen. These statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes information on recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition we are lacking. Nothing here is intended to be a substitute for treatment or a visit to your primary healthcare provider. So that having been taken care of, I'm going to turn the time over to our show hosts tonight. And this is Dr. Court and Jonette Biebensheimer. There we go. Look at you guys. That background.
Oh,
that's better than real, isn't that?
Yeah.
You need to mute yourself. It's real too. That's not a green screen.
No, I think we're unmuted. Are we good?
You are good. Way to go.
You ready?
I'm ready.
Why don't you go ahead and introduce Dr. Prasad?
You want to pull up the...
I'd be glad to.
Thank you. It is with great pleasure that I'm going to introduce Dr. Prasad, the foremost authority in research for micronutrients and the world's first PhD radiological biologist. Dr. Prasad taught at the University of Colorado School of Medicine for more than 30 years. He was the director of vitamin and cancer research. He was also the former president of the International Society of Cancer and Nutrition. He was a member of the British Society of Medicine, and he was personally invited to sit on the Nobel Prize nominating committee for candidates in medicine.
In 1982.
In 1982. He was, as I said, the world's first PhD radiological biologist. I like to add that it was a 7.5 year program, and he finished it in 3.5 years, thereabouts. He was awarded 7 US patents on micronutrients. He discovered the anti-cancer potency of vitamin E succinate, and he discovered the anti-cancer agent butyric acid. He's also an author of more than 32 textbooks. He's published more than 250 peer-reviewed papers, and he is listed in PubMed more than 450 times. Oh, with great pleasure, Dr. Prasad, welcome to the Optimal Longevity Series.
Thank you, Dr. Court. It's my always pleasure to be with you and Jonette. And any way I can help to explain whatever people wants to know, I will be glad to do it if I know it. If I don't know it, then I will do research and find out what's the problem.
That's one of the things we love about you. But we know you know tonight's topic because
yes,
we have it in your textbooks, we have it in your papers. You are well versed in tonight's topic.
And also I worked with Dr. Kazias while I was in Brookhaven National Laboratory, who discovered L-DOPA, the treatment of Parkinson disease, when I was there. So I worked with him on this issue, so I become familiar with Parkinson's disease. Being a radiation biologist, then I have to say, I was put under the, guardianship of Dr. Kazia, which was doing, he has nothing to do with radiation biology. So I started doing Parkinson-related research. So
I don't know if people understand how blessed and lucky we are to have you here talking to us about Parkinson's, because just what you said, you were there when L-DOPA was discovered.
I worked.
And You were part of that
The
program.
basic research, yeah, I was doing basic research, and he has a clinical in Brookhaven laboratory. He has a 12-bed Parkinson patient, and he tried everything that failed. But when he tried L-DOPA, it worked miracle.
Doesn't get better than that, does it, Jet?
Yeah. So I'm gonna back up a little bit. So I'm gonna describe a little bit of what tonight's call is. We're gonna screen share the optimal longevity series, and I think it's important that we always go back to this screen because Dr. Prasad, you really are the epitome of a good health span. Your lifespan is how long you live. Your health span is how many years you live a healthy, vibrant life. And you want your health span to equal your lifespan.
Yeah.
I think this is a really important graphic because we don't have to be the top part of this graphic. We can take Dr. Prasad's education and life's work and implement that into our daily lives. And so when it comes to optimal longevity, we've talked a little bit about many different topics, from stem cells and diabetes to, all kinds of different topics. But tonight is a very specific topic on Parkinson's. And I actually took a course, Dr. Prasad, with the Cornell University Field Family Brain and Mind Research on an overview of what's currently going on for diagnostics about 3 months ago. And one of the things that was very interesting to me is so much research, as you know, has been done on Alzheimer's. But Alzheimer's has 6 million diagnosed in the US, which is really memory related. But in Parkinson's, of movement disorder, it's 1 million in the US. It is the fastest growing neurological disease in the US. And there's more men than women. But some of the things that I found very interesting that I wanted to share before we go into your research and what Dr. Fort sees as symptoms, which I think is really important. When it comes to diagnostics, there's a lot of work being done, but there are a lot of radiation, and when they're doing these. And so the number one predictive diagnostic that they're using for Parkinson's right now is actually called rapid eye movement sleep behavior disorder. It is being used at a 90% predictive rate 20 to 30 years before diagnosis. So this is because we measure sleep, okay? One of the things that came about is that they become very, they're punching.
They're violent.
They're violent in their dreams. They're acting out their dreams.
Right. And so it's almost like thrashing nightmares.
Very violent.
Very violent, but it lasts most of the night.
Yeah, 20 to 30 years before. And they don't get to REM. And so they have a very low REM rate. And instead of going to, some fancy, this is a really important thing that everybody can look at right now. Your bed partner would know if you are very, you move a lot, you punch, you kick, and you're acting out your dreams. And that's something that with a 90% predictive rate, we really could get after this. And these people, your strategies that we're going to talk about tonight could make a huge difference in the quality of their life. I wanted to share that. And also the research that they've done at Cornell at the Field Family Brain and Mind Research Center is that the Midwest is known as the Parkinson's belt because of the pesticides of paraquat and solvents used in rural areas. So now they're really starting to pinpoint that. And again, it is the fastest growing neurodegenerative disease in the US with not nearly as much research, current research, as Alzheimer's. But I want to segue real quick, Dr. Prasad. Isn't that interesting though about the rapid eye movement?
Ask him.
Yeah.
Did you know that, Dr. Prasad?
No, I didn't.
So I love that they really, it's something that we can, our bed partner, we can be able to start working on and have a way and not being able, it's a simpler diagnostic.
And it's years, decades.
No, 20 to 30 years before.
And
Yes.
so it is a good time to intervene if somebody is expressing that kind of behavior.
Yes. So I wanted to go to some of your research, Dr. Prasad. I pulled up a little bit, and I don't normally do this, but I wanted to show people because this is important. Okay.
Sure.
Started with this postdoc at Brookhaven and Parkinson's, but let's just look at a few of the papers that he's done, and we're going to walk through those real quick. Let me see. Okay. So we're going to, 1 second here. We need to go to the very first one. Dr. Prasad wrote this paper in 2003, and can we prevent Parkinson's and Alzheimer's disease? And so here he is laying the foundation over how many years ago?
A long time.
20 years ago, right?
Yeah.
And I reviewed this paper today and I thought, wow, he knows just a little bit about Parkinson's. And then the next paper.
I haven't talked about this paper.
Do you want the brief abstract or a couple sentences about this paper, Dr. Prasad?
I forgot what I said in this paper.
I was just going to ask you, you have over 250, 60, 70 papers. Do you remember this paper?
Well, this is the first time it looks like I have suggested that use of a multiple micronutrient
It is.
to intervene. So that was a long time ago. But
Yes.
at that time, we didn't have any product or anything. It just suggests based on science that we were doing research on. And we have a cell model of Parkinson where we put a alpha-synuclein gene in neuroblastoma cell and did a lot of experimental manipulation to see how we can prevent their death. So that's the reason it came out all these kind of.
But at this time you had the premier micronutrient.
No,
you didn't have that yet.
No.
So in the summary of this paper, this review provides a brief description of the epidemiology and pathogenesis of Parkinson's and Alzheimer's disease and the scientific rationale for the use of a multiple antioxidant in the prevention of these neurological diseases.
Yeah.
So, no, folks.
It's prevention aspect, not the treatment aspect, just the prevention aspect.
Yeah, the
Because
prevention.
at that time, I was too busy in doing experiments. Yeah.
Moving forward.
This is the recent one. This is the recent one. Relatively speaking.
This is actually a fairly recent paper.
Yeah.
In 27, I'm taking Dr. Prasad down memory lane, everyone. Okay. So this is a paper that I love this paper, Dr. Prasad. It's 2017 paper on oxidative stress, pro-inflammatory cytokines, antioxidants that regulate the expression levels of microRNA in Parkinson's. And what he really did for people on this, these are great papers for you to look up if you're interested. This particular paper, he really took the time and looked at all the microRNA and how they modulate gene expression. And I really think he really used this to help make the microdaily EMF product, because when he chose the green tea and the resveratrol and the curcumin, and he added these other nutrients, he did it based off of some of the microRNA tables that are in here, and they are fantastic, Dr. Prasad.
Tell us more about this paper,
Tell us
because
about this paper.
you're sitting there telling him what he did. I want to hear what
Okay.
he said he did.
Okay.
Please.
No, I mean, this is when I was reviewing it, this is the first time we said that increased oxidative stress and pro-inflammatory cytokines is extremely important for the development or initiation of Parkinson's disease, and as well as progression of the Parkinson's disease. And microRNA is very interesting molecule because microRNA, I don't think I can go in detail, but it will be rough for the audience to understand it, because microRNA is made by the non-transcript, in other words, you have a DNA, you have active form and non-active form. Only 5 or 10% are actively involved in transcription of your genes and many other functions. But the non-coding part of the DNA is people thought it has nothing to do with anything, non-coding, it has nothing. But non-coding part is the DNA which makes this microRNA. And job of the microRNA to monitor it depending upon what kind of signal it gets. If it gets a signal from oxidative stress and pro-inflammatory side, if this makes RNA which allow the formation of a toxic or harmful protein. But if it gets a signal from antioxidant or anti-inflammatory agent like, curcumin and vitamin E, C, and so on, then it makes a different types of microRNA, which allows the formation of a beneficial protein. So that was very exciting to think that non-coding region of the DNA plays a very important role in regulating our health, really, that people have ignored in the past.
And what's so fascinating is that for a very long time, the hypothesis was that they were just junk.
Junk, yeah,
Well,
exactly.
and that's not true at all.
No.
It's also fascinating that we had already met Dr. Prasad when he wrote this paper.
Yes.
So now we're coming into the picture that you were our friend, and we were already working and reading your papers and so forth. And so this was.
Hey, are you talking to me?
That that you had written since we've known you.
Yeah, I know. And this is very. Only thing is missing is two components missing in this article. One is the role of this intestinal dysbiosis, which has a lot of extensive data to show that the ratio of harmful bacteria is increased over beneficial bacteria. And so
elaborate on that a little bit more. And what's the second one?
The second one is for example, this what do you call probiotics and omega daily or omega-3 daily.
What a great time to talk about that.
Hang on, we're going to get there.
I know, but I want to get there now.
You're jumping ahead.
I want it now.
I got to watch him because he'll take me on and I'm walking this through. This is really important that I'm going to the next study. Okay. And actually in between here, Dr. Prasad wrote a couple textbooks. He wrote a neurological textbook that I have. And then he also wrote a textbook this thick on many diseases, where he also wrote about Parkinson's again. So between here, there are some incredible textbooks if you want to know more. And if you are a health professional, you definitely need those textbooks. And now we're going to the last paper. And the reason why this paper is so important is we started in 2003 with Can, right? And he's proposing, right, this antioxidant mixture. And then he's actually doing this last paper on microRNA and oxidative stress and cytokine storm. And now in this paper, okay, he actually talks about familial genes. If you're diagnosed with an Alzheimer point mutation, Parkinson's point mutation, Huntington's chorea, sickle cell anemia, this paper says, what does it say, Dr. Prasad? This is a very...
It is possible that using the right kind of micronutrient mixture, you can delay the onset of the disease. So most of the mutation-related diseases, single mutation, appear at the age of 35 or 40. But it can be delayed markedly. Why? Because when people have measured the level of oxidative stress in these patients who have a genetic family history, and long before the symptom appears, they found the level of oxidative stress and inflammation is increased. So this is the time, earlier time, as early as you can, to downregulate, to decrease the oxidative stress and inflammation. And therefore, these are the two agents, two defects, contribute to the development of the symptoms of any genetic disease. And therefore, if you decrease them, then it can delay. So instead of 35 or 40, you may have developed when you are 80, 85, or 90 by the time, at least in my case, I'm ready to leave this planet, So...
No.
But, I mean, most of the people, the average age of the US population is 78 years. And so, but like Jeanette was saying, that 78 years should be full of energy and excitement rather than having a disease and so on. So it is very important that even genetic disease and it can be done, and we have experimental evidence to show that this is possible.
Well, and for me, I have the APO E or that be homozygous recessive. So I am that person. So genetically,
Yeah.
I know that, but in the studies that I listened to at Cornell, that wasn't always the case. That just because they had that, they could see that there were other patterns that they didn't always express and have the disease. And so this is really important that I laid this foundation for us tonight, because Dr. Prasad is an expert of Parkinson's. He is an expert of being able to reduce oxidative stress and inflammation simultaneously. And so let's talk a little bit about some symptoms. And you could talk a little bit about that real quick.
You know,
Okay.
it was great because this last week I was with a client, and I had to sit he and his wife down and explain to him that he had pre-Parkinson's, and he was getting ready to go to the Mayo Clinic in November. And I said, look, that's what they're going to tell you. You have pre-Parkinson's. And then the very next thing out of my mouth is that I'm going to do everything in my power, nutritionally and with my knowledge, so that you outlive the onset of this disorder. And that's exactly what you just said, Dr. Prasad, on that paper that you wrote, that it is absolutely possible to delay the onset. And if you're 80, you can most likely delay that onset for the rest of your life.
Yeah. Correct.
Yep, correct.
But that hasn't been the case.
That hasn't been the case.
I mean, people feel very hopeless on
I
this.
think after a month, I like to hear about that patient that Dr. Court and Jeanette, you visited them, how they're doing it.
Well, we're going to be flat out with it, working on it. So, you know, some of the, did you want to go ahead?
No, I wanted you to, this isn't a complete list, but I had to find one that I felt Dr. Court could go over. And then we've got a few extra ones of symptoms for people on here to pay attention if they or their loved ones or friends have these types of symptoms.
Well, I think that, and this is so important for Dr. Prasad as well, as we talk about the symptoms, because some of those symptoms he can relate back to a couple of studies ago where we were going to talk about the gut and the gut biome and how the gut biome affects Parkinson's specifically. So some of the first symptoms that we see, as Jonette was saying, is a violence in their sleep, trouble sleeping, but not just trouble sleeping. That could be snoring, but it also is a violence in their sleep where they're not aware that they're thrashing and yet, you know, punching, and literally just through the night they're fighting constantly through the night. The other thing that we see that's very, and this is 30 years,
20 to 30 years
20
before.
to 30 years before the symptoms or the diagnosis of Parkinson's ever shows up, we have this issue with violent sleep, trouble sleeping. And sleep is so vitally important. We talk about it all the time. In addition to that, constipation.
We want to talk about constipation.
You know, it's a crappy thing to talk about, but just the other day, I was asking a woman, I said, you know, how often do you have a bowel movement? She said, oh, I'm very regular. And I said, really, what does that mean? And she goes, well, once a day or once every other day. And I said, do you have a dog? She said, yes. And I said, how many times does he go to the bathroom? I mean, if you eat, you poop. And if you don't, then you're constipated. Yeah. And diarrhea is the same thing. It's just a different kind of constipation. So keep that in mind, folks. If you're only having one bowel movement a day, you absolutely need to do something about that. And we have products to help with that. Isn't that correct, Dr. Prasad?
Yes.
Okay. So the other things that we see years ahead of time is this kind of masked face. It's a face of like, or like this.
Expressionless
Face. But what's really frightening is that if you look at children watching television or sitting on their electronics, this is the same face. You can just go and, oh, you can't see me?
Because you're on a screen share.
Sorry. Mouth open, expressionless. I'll show you when we get off the screen share. The other thing that we see is a loss in their voice. So their spouse may be going, you know, speak louder, but they have a very quiet voice and it's difficult to hear them. The other thing that is another symptom that happens very early on, years ahead of the tremors, is that their handwriting goes from normal to very small, like itty bitty. And that's a telltale sign that we look at. Then we start to see some of the others with some dizziness. I haven't really seen a lot of fainting, but dizziness. Tremor is something that we see later on in the progression of it, but it can still be pre-Parkinson's. In the case that we brought you in on, Dr. Prasad, I didn't see the tremor until he had a couple of glasses of wine.
He had one.
And then after he had the wine, the tremor started to show up a little bit. So the alcohol is a problem. And
like it affected the brake.
It affected the brakes in the brain that actually keep you from tremoring in the nigra and the basal ganglia. And then trouble with moving. So we start to see a stiffness, and we also see a change in the gait. And one of the things that we see in change in gait is we see a decrease in the hand swing, where the hands just drop down to the sides and they kind of walk like this. But this is one of the big ones, and you probably haven't heard this, and it wasn't on the list. So this is a DK one. But Dr. Prasad, think about this for a moment. I'm going to you have no idea what I'm going to say, so I'm going to put you on the spot. But we have a lot of people who wear readers that are like half readers. Like and this. So they work on their computer like this, and then they do everything else like this. And so if they're driving their eyes forward, and they have this forward posture, do you think that they feel like they're going to fall? Because you see this in the Parkinson's position, they stand like this. Yeah. Do you think that they think they're going to fall forward, or are they going to fall backwards?
Oh, you're asking me?
I am. What do you think?
I don't know.
Okay, well, here it is, folks. You're going to hear it here first. They're going to fall backwards because they drive their system by looking over their glasses with their eyes up. Then when they stand up straight, they feel like they're going to fall backwards. So in Parkinson's patients, they feel like they're going to fall backwards. If you are wearing the readers where you have them down like this so that you can work on your computer, stop immediately and get glasses that you can see, and then take them off, or like I do, flip them up. But don't look over the glasses.
Yeah, that's a really important part. But you know what? Dr. Court's eyes are getting better, so he has to take his glasses off a lot because of the omega-3.
Yeah, the omega-3. I'm driving with them like this, or I keep leaving them in different places because my prescription. And the other thing, this was so interesting. Jet brought this to me the other day. Dr. Prasad, you and I have spoken at length about cataracts, but did you know that cataracts are a precursor to Parkinson's?
No.
26% of the people that have cataracts are more apt to have Parkinson's. And so I brought it to his attention because I do think that there's that stressor, with that.
The cataract, for example, radiation-induced cataract is very well-known phenomena. And of course, as you know, it increases the production of free radical and inflammation. And so it's well established that the main reason of cataract formation in the eye is local increase in the free radicals and inflammation. And retina part of the eye is highly oxygenated, and therefore they can generate a lot of free radicals. So until you have enough sufficient amount of antioxidant in the eye accumulated, then you can develop all these kind of issue.
So in that situation, the product, we would be taking the.
Hang on, I'm gonna pull up the Core 4. Okay.
I'm a racehorse tonight. I'm just full throttle. Here we go.
Ready. And you know what? So for everybody on here, there is hope. If you have any of these symptoms, we are here tonight with, a novel approach by Dr. Prasad, laying the foundation from 2003, actually since 1963, studying Parkinson's all the way to today. But even if you have the genetic mutation for Alzheimer's, for Parkinson's, that right now today, this is going to be the strategy. Jeff, could you pull up the core 4? And then Dr. Prasad, I also was going to have him pull up the brain boost.
Well, wouldn't you want to hear? I wanted him to talk about his paper that he was talking about the gut a little bit. Did you want to wait for that, or?
Oh, the anti-aging paper, Dr. Prasad?
We're talking about the importance of the gut biome. And
Yeah, I mean, that's very important. But
Yes.
a couple of things that people may like to know about the Parkinson's disease before we shift it. First, did you know that Asian and Black have the highest incidence of Parkinsonism? And like Janet said, men has more than women. And the second, but in case of Alzheimer, this is reverse is true. In the case of Alzheimer, you have more women than men. But but another thing is that right now, the most important chemicals, toxins that are used as a model to produce Parkinson, do you know? It is called MPTP. It's a huge, big name, MPTP. And how it was discovered? Because in the early 90s in California, people were taking a recreational drugs and contamination, and they had increased incidence of Parkinson's disease, and doctor didn't know why. So some smart scientist said, well, let us see what are the chemical constituency of the recreational drug, and they found MPTP. And sure enough, MPTP was responsible for inducing. So if you are taking a recreational drug, you could be high risk if you don't know it has a MPTP. So this is very important to remember.
That. I do remember.
Yeah. And right now there is hundreds of paper people use because they did not have before any tool to study how it is do, what experiment you can do. As a matter of fact, we did experiment in collaboration with in Nashville, Mahiri Medical College, the college, and we have a friend there, and he was very expert in animal model of Parkinsonism. So he used the MPTP as a model to induce Parkinson's disease. And so when I talked to him, I said, I think, maybe multiple antioxidant will reduce it. So again, same preparation that we use for a radiation protection and all these kind of things. Same, in other words, the antioxidant component of microdaily mixture, we used it. This is very interesting. Then as an additional control, he used a curcumin as a single agent. And then you have a multiple antioxidant, and then you have without any treatment. And of course, without any treatment, the animal exhibited all the expected symptoms of Parkinsonism. And when they had just one antioxidant like curcumin alone, that they found that, some improvement. But when they did a combination, it was a dramatic improvement. And even the enzyme, which curcumin did not affect it, called tyrosine hydroxylase, which is a late-remitting enzyme in the synthesis of dopamine. And you need a dopamine to perform regular function. And so they found that this mixture of antioxidant not only prevented the symptoms, but also enhances the activity of tyrosine hydroxylase, which is enzyme absolutely essential for the formation of dopamine. So here is another example of animal model, at least, that we can say that these multiple antioxidants can be very useful in reducing the risk as well as the progression of Parkinson's disease.
Well, I'd sure like that paper for my client. That would be cool.
Yeah, I can send you. I mean, we have published that paper. And so it is very interesting. But also that, so MPTP was a very interesting story. That's why I mentioned it. And so the question is always that it is not only most of the Parkinson's disease acquired, only 2 to 3% have a genetic component. A genetic component means you have a mutation in alpha-synuclein. You have there's a whole bunch of marker of genetic marker of Parkinsonism, which is very important for normal function.
Parkin1,
DJ1, DJ1, Parkin, and so all these mutation occurs. So there is only 2 to 3. So best is, and like you mentioned, the Midwest is really because they were using all this kind of a herbicide in a field. And actually, my neighbor who comes from the Midwest, and he was exposed to this kind of thing, and he has Parkinsonism.
Mm-hmm.
So we're talking about.
So it is very important to have a prevention component, and but as how to intervene, prevent the progression or the development of things. And so now, for those people who are already exposed too late, and so, but still we can reduce the rate of the progression of the disease. So anytime you can intervene with micronutrient mixture that we have, and then of course intestinal dysbiosis is extremely important. Almost all diseases, Alzheimer, that I have already published that paper, and dysbiosis. There is another paper I just I'm revising it, where I have emphasized this intestinal dysbiosis is on diabetes. Mm-hmm. So the paper in the Journal of a College of Nutrition, which was a very famous journal, and so they have accepted it, but they asked to revise, minor revision, no problem. Mm-hmm. So, but Parkinsonism I have not emphasized because I have not written anything. But next would be the Parkinson disease. But so it is very important to remember that at any stage, now we know we have a full spectrum how to improve it, how to prevent it, how to reduce progression, and how in combination with a standard a standard therapy like DOPA therapy, and this will enhance their effectiveness, because one of the problems of L-DOPA therapy, or they have a various name of DOPA therapy, but the main reason is because they increase the dopamine level in your brain. Mm-hmm. But for dopamine level in your neuron, in substantia nigra, the neuron has to be alive. But increased oxidative stress and these things are killing them, and L-DOPA has no effect on that. Not only that, L-DOPA, if you are producing excessive amount of dopamine, they get auto-oxidized and produces a lot of free radicals. So for 5 years, it is a magical effect of L-DOPA. Then after 5 years, patient becomes worse because of the, free radical being produced, did not address this issue, gated, become tighter, life becomes more, the quality of life becomes more compromised at that stage. So if you combine them with micronutrient that we have, you can take advantage of both. You can extend it, and you may not develop the side effects of L-DOPA that generally you see after 5 years, because whatever they are doing, even DOPA, when gets excessive amount, DOPA get oxidized in the brain, generates free radical. Now DOPA is producing a lot of more dopamine, the cell needs it, then dopamine get oxidized and generates free radical. So you want to prevent it. And this is one way to preventing it. And then the side effect of dopamine, because L-DOPA is a gold standard. Also neurological. They use some other drugs, but I think, this is considered a gold standard, L-DOPA therapy.
And one of the things that I love is there's no medication contraindications for
No. Whether it's Alzheimer or whether it's a Parkinson disease or any disease.
I want to go back.
Yes, now you can go back.
I just want to go back just a little bit. And you were talking about the herbicides in the Midwest
and pesticides.
And the pesticides. So we're looking at Roundup. I'm just going to hit Roundup.
In specific, it's Parquat for
Parquat, okay.
And solvents.
Paraquat, yeah.
Mm-hmm.
And also manganese minor. Manganese minors.
Oh.
The people who work with manganese.
Yes. Manganese miners.
Miners, yeah.
And a mine.
Yeah, and he used to visit Brookhaven National Laboratory, and they have very high incidence of Parkinson's disease.
So interesting.
Well, so do our
manganese, again, when you combine, you have an excess amount, they will combine with vitamin C-like molecule and generate a lot of free radicals. So at least we know for sure that manganese miners have a very high incidence of Parkinson's disease.
Right, and so do our veterans, which it's great that they can get the products that.
Yeah, but it's a surprising thing that we have not been able to attract veterans. I don't know why.
Well, I don't either. That's another conversation.
Okay.
I'm just so grateful that we have the ability to be able to offer them the best price, better than your professional price as a physician.
Sure.
You know.
Now I have another question for you, Dr. Prasad.
Let me ask one question. 5 minutes before 6, I have to go.
Okay. Perfect.
So-
Then let's transition to the next part, Dr. Court, so we can give a solution.
Yeah.
Okay. I'll hold my-
We can do it again on this topic because this is a very interesting topic. We can discuss more mechanistic
my
study
question
later
next
on.
So I'm sorry, Jeff, you might be able to squeeze it in. But Jeff, would you mind showing the Core 4, and then we'll also pull up a picture of the Brain Boost? Are those the products you would like to have up, Dr. Prasad?
Yes,
Core
definitely.
and Brain Boost?
Core 4 and Brain Boost.
Right.
So why don't you run us through, Dr. Prasad?
Yeah,
What
okay. It's
is
very
it
easy.
for?
Yeah, Core 4 is that, as you know, micronutrient EMF, either hydro or capsule, whatever form you use. But if you are first-time user and you have an active disease of Parkinsonism, I would recommend take a hydro, and then it will reduce the oxidative stress and inflammation, so your neuron is protected, and therefore, whether you are taking medication or not, it will be very helpful.
What makes this product so absorbable? Why does it work on every body?
Everybody, because this is absorbed quickly, and most of the people may be terribly deficiency in macronutrient. Our diet is terrible. And even though no matter how much we say, modify your diet, nobody does it. And so the second best thing is that we have to have provided micronutrient in sufficient amount, and that's why we have micro daily EMF. So this is very important. The next topic is gut dysbiosis. Gut dysbiosis is that number of harmful bacteria increases, which produces very toxic chemicals such as pro-inflammatory cytokines, as you know, which will be absorbed and will affect all organs in your body, including brain. And it has been demonstrated experimentally in a human study that gut biosis does occur. And the severity of gut biosis is correlated with the severity of Parkinson's disease. So this is very important. And so how do you reverse it in favor of beneficial bacteria? One and only way is the probiotics with prebiotics that we have. And so that's second one, the best choice. And the third one is omega-3 fatty acids. As you know, the brain has a lot of membranous structure, a lot of receptors. And for the formation of those membrane and receptors, they require DHA. That's why in the brain, they have measured in human and animal that 40% of fatty acid in the brain is DHA. And we have in our formulation, we have a DHA and EPA in the ratio of 2:1, because it has been shown clinically, this is very important for your brain function. And the one way you can get it is through us, or if you are a vegan, the algae has already made, but when you extract from algae, there is a hazard. There is a hazard of getting a contamination of heavy metal. So make sure that product, if you are a vegan and taking it from algae, make sure it has no mercury, no. But our product is highly purified from fish, varieties of fish, and this is highly purified, and we have a full confidence tested by third party. The DHA and EPA is very important. And we also have omega-6. Omega-6 is also essential fatty acid that our body don't make it. But omega-3 fatty acid is beneficial effect is the dose dependent. A small amount will act as a anti-inflammation. High amount is pro-inflammatory. And so US diet is 1 to 10. In other words, we have 10 times in US diet or Western diet in general, the omega-6 than omega-3. And that's why we have so much problem, health issue in that way. So in order to avoid those kind of things, we have added this omega-3 fatty acid, and we have a tiny amount of omega-6 as well, because they are also essential, considered essential fatty acid that our body don't make it. And the fourth one is collagen peptides. And in collagen peptide, overall, it present in every place. And in a Parkinson disease, it has not been studied experimentally as yet. But my feeling is that the collagen type of 6 is present in a neuron. But Alzheimer's, this has been demonstrated, at least experimentally, that it is very useful to neutralize the beta amyloid, which is toxic. But I have not seen any evidence of Parkinsonism. I have to look into this, but I also recommend fourth one is the collagen peptides. And the last one is the, which is not here.
Jeff, can you put up the brain boost, please?
Brain boost.
And eye boost, actually, because the eye boost for the cataract. Don't you think? Or the omega. I like the omega for my cataract. Makes my eyes feel so much better.
Yeah, brain boost is also very important because not only we have provided additional antioxidant, more powerful like resveratrol and curcumin, but also provided additional substrate for mitochondria to generate the ATP or generate energy. And one of them is additional coenzyme Q10 and additional nicotinamide. Dr. Code, I can't pronounce.
It's beautiful.
Nicotinamide. They are all used very important for the mitochondria. Without that, they can't generate energy. So we provided additional amount. And then we are also provided a two precursor of membrane, is a phosphatidylserine and phosphatidylcholine. And so that when membranes are formed, new membranes are, because membranes are all the time destroyed and formed. When they are formed, now we have given them enough antioxidant for protection, so they can be all protected. So brain boost is unique and is very important to have it. And same thing is eye boost. Eye boost is also important if you have eye problem or want to prevent eye problem, because generally human pigment has a two pigment, lutein and zeaxanthin. But birds like eagle, who can see the prey from way far from the sky on the ground and pick it up, so they can see it. So I said, why they are seeing like that? So when I did research, I found out they have a three pigment. One is astaxanthin, and astaxanthin we added it because it is non-toxic, and it accumulates in an eye several times more than any antioxidant that we provide them, like lutein or zeaxanthin or anything like that. And so this becomes extremely important. A lot of clinical study has been done with just lutein and zeaxanthin, and they have produced some beneficial effect. But ours is the best for prolonged effect, and so those are the. And CBD is very important, especially in later stage of Parkinsonism, when you become agitated, you see hallucinations. You have a memory, you have all this kind of behavior problem. And so in that case scenario, I will recommend that you take 100 to 200 milligrams of CBD before going to bed.
The agitation is one of the symptoms that I didn't see on there, but you're absolutely right.
Yeah.
Ugly mood swings. They get quick, very, very angry, very quick, which is also a symptom that we see in EMF quite often.
Yeah.
Many of the symptoms that we see in electromagnetic hypersensitivity or in multiple sensory sensitivities.
Because that's in a Parkinson disease also, there is excessive release of glutamate. And that is the one which is causing that kind of agitation, hyperactivity, angry. And the product that we take these kind of things, for example, CBD and micronutrient, they will downregulate. Not only they will prevent the release of glutamate, but if glutamate is already formed and there in extracellular spaces of the brain, antioxidant will protect it.
Here's
Hang
an
on,
interesting
and I want to say
question.
this. Nobody has a product like that.
No,
Right? Any
nobody.
neurological issue, this is really key and fundamental.
And this is the first time anybody has wrote about a multiple approach. In the beginning, we were having a single approach, but it is a multiple approach. And that's why I have emphasized in a previous paper in Alzheimer and emphasized on diabetes as well. And then maybe third one will be Parkinsonism.
Do you think that, utilizing the omega-3 product and also the CBD, will they compete for those endocannabinoid receptors, or is it just
No. Because endocannabinoid, because omega-3 is they act as a ligand. They mimic the effect of a anandamide and 2-AG.
They
So
mimic.
exactly activate
Mhm.
the CB endocannabinoid receptor. Otherwise, to activate it, you have to activate and you have to produce a lot of anandamide and 2G. There's two ligand, they call it, and so they almost mimic the effect of these two ligands. So you don't have to activate them, and so it is very important. And then they may work by different mechanism than say CBD exit. That will take a long time to discuss it. And
Wow.
I have
We have to
1 minute
discuss
to go.
this
1 minute.
more next time.
No, hang on. We'll do another call on this, but this was a very good call, Dr. Prasad.
Yeah.
You were on, was he on fire?
Fire!
But we want to go ahead and wrap up, and you want to tell them that get back to the person? Right?
Yes, please get back to the person that brought you on the call today, that suggested you come on the call today.
And for all optimal longevity series on this one and other videos we do, you can see them on YouTube on Team Serve. And if you want to unmute, you can say goodbye to Dr. Prasad.
Thank you.
Thank you,
Thank
Dr.
you.
Prasad, for your time.
Thank you, Dr. Prasad.
Thank you,
Thank
Dr.
you.
Prasad.
Thank you.
Dr. Prasad.
Bye.
Thank you, Dr. Prasad.
Good night, everyone.
Thank you, Jonette. Thank you, Dr. Court.
Good night.
Thank you.
Thank you. Good night.
Good night. God bless.